Bismillah ar-Rahman ar-Rahim. We will continue to discuss the reticular activating system. In the last lecture, we talked about the functions of reticular system in the brainstem. Now, functions of the reticular activating system. Now, as already we discussed the different parts of the reticular formation and reticular activating system. This is lateral view of the cerebrum, midbrain, pons, medulla oblongata, which is continued as spinal cord. So here in the brainstem is the reticular formation of the brainstem. And closed and parallel to it in the brainstem is the components of reticular activating system. This is the ascending neural pathway of reticular activating system in the brainstem. And this is descending neural pathway of reticular activating system. Now there is so much happening around us all the time, but we can only consciously focus on a few things at any one time. Now reticular activating system focus us on only those things or sensory inputs which are important for us. Reticular activating system, it focuses only on sensory inputs and focus us consciously on few things at that time. It focuses only on those things or sensory inputs which are important for us. And those things are sensory inputs which are important for us. The reticular activating system thus acts as a filter. It acts as a brain filter. And prevent overloading of the cerebral cortex by many sensory inputs. Reticular activating system locks or unlocks your brain for required or unwanted signals to reach your brain. Now, reticular activating system thus acts by sending filtered or selected signals to your cerebellum. Reticular activating system thus acts by sending filtered or selected signal or filtered signals to your cerebrum. For what purpose? Number one, to maintain consciousness and attention. To maintain consciousness and attention. Number two, to pull us to sleep. Number three, to create dreams. During sleep. Number three, to wake up from sleep. Number four, to wake up us from sleep. Number five, to create dreams. To create dreams, to wake up for us from sleep, and to habituate to prevent sensory overload. To prevent sensory overload. Thus acting as brain or mind filter. Thus acting as brain filter or mind filter. These were some important roles played by the reticular activating system. Now, what are the functions of reticular activating system? What are the functions of reticular activating system? So number one, acting as brain filter, most important function. Reticular activating system acting as brain filter. There are many random stimuli in our environment which you do not need to pay attention or respond to them and ignore most of these because that are not important or related to what you are doing at that moment. So reticular activating system prevent these unwanted stimuli to reach your cerebral cortex. Reticular activating system prevent these unwanted stimuli. To reach your cerebral cortex. Number two, maintaining consciousness and awareness. Number two, maintaining consciousness and awareness. Reticular activating system send signals to the cerebral cortex at regular intervals to keep us awake. So send signals. At regular intervals. To cerebral cortex to keep us aware, to our cerebral cortex to keep us awake. Next, third function, sleep. Reticular activating system has important role, sleep. You get sleepy when these signals to cerebral cortex are decreased. You get sleepy when these signals to the cerebral cortex are decreased. The signals, when these are decreased to the cerebral cortex, decreased in frequency, and it causes you to sleep and causes you to sleep. Sleep disturbances and coma are related to the dysfunction of reticular activating system. Sleep disturbances and coma. Sleep disturbances and coma result when there is dysfunction of the reticular activating system. What is coma? Coma is permanent unconscious state. Permanent unconscious state is the coma. Next function number 4. Creating dreams. Role of reticular activating system in creating dreams. So once we do fall asleep, about 90 minutes or so, we are going to send signals to the cerebrum while we are sleepy. This is going to create dreams. Next, awakening or arousal. Another important function of the reticular activating system. When we begin to wake up, these signals are going to increase in frequency. The signals increase in frequency. The signals to cerebral cortex increase in frequency. And wakes us from sleep. And wakes up from sleep. Number 6, another function of the reticular activating system. Role of reticular activating system in regulating sensory and motor stimuli, in preventing sensory overload. Role of reticular activating system in regulating sensory and motor in regulating sensory and both sensory and motor stimuli, in preventing sensory overload. The regulation of both sensory and motor stimuli in preventing sensory overload. Sensory overload. Now, summary of ascending or sensory neural pathway of reticular activating system and descending or motor neural pathway of reticular activating system has already been explained in a previous lecture, as also shown in this diagram. In the middle is the reticular system, and on each side parallel to it is the ascending or sensory neural pathway of reticular activating system, and close to it again is the motor or descending component of the reticular activating system. Now, ascending pathway of reticular activating system. Ascending or sensory pathway of reticular activating system regulate following stimuli. Regulate following stimuli. The ascending or sensory pathway regulate which stimuli, that is touch, pain, temperature, sensations like touch, pain, temperature, hearing and visual. Hearing and visual sensations. However, the reticular activating system do not regulate smell stimuli. It regulates these sensations like touch, pain, temperature, hearing, vision. But however, the reticular activating system of the brain do not regulate smell stimuli. Do not regulate smell stimuli. It regulates all the sensations except the smell stimuli. Now this was about the ascending or sensory pathway of reticular activating system regulating different body, different sensations except sense of smell. Now what about the motor pathway, descending pathway of reticular activating system? Descending or motor pathway of reticular activating system. The descending part of the reticular activating system regulate what? Muscle tone, posture, balance. Muscle tone, posture, balance, heart rate, respiratory rate, blood pressure. Heart rate, respiratory rate, and regulate blood pressure. So these were the role of ascending or sensory pathway of the reticular activating system and the role of descending or motor reticular activating system. With this, we finished with this important part of the reticular activating system, their functions and their role in the sensory activities and motor activities. Thank you very much.